Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Toxoplasmosis symptoms, treatment and prevention. Toxoplasmosis is a disease caused by the parasite Toxoplasma gondii. This parasite is a tiny single-celled organism called a protozoan. People can acquire it from undercooked meat and exposure to cat feces. /r/n/r/n in healthy individuals, this infection doesn't usually do lasting damage and often shows no symptoms. But people with a weakened immune system and babies born to a person who acquired the infection for the first time in that pregnancy are at risk of more dangerous infections. /r/n/r/n Toxoplasma grows in and affects various parts of the body, including the brain, eyes, and muscles of the heart and body. It forms bubbles in the tissue called cysts that house the parasite. These cysts may persist after the person is no longer sick. The cysts can reactivate the infection when a person's immune system weakens. /r/n/r/n This article will cover the symptoms, causes, diagnosis, and treatment of toxoplasmosis. /r/n/r/n illustration by Joules Garcia for Verywell Health. /r/n/r/n Toxoplasmosis may be mild or severe. People with weakened immune systems are at risk of severe disease. This includes people taking certain medications and those with autoimmune disorders, cancer, or certain immune system infections, like human immunodeficiency virus, HIV. /r/n/r/n Also, a newly infected pregnant person can transmit it to the fetus, resulting in a risk of pregnancy loss and serious health problems for the baby after birth. /r/n/r/n The three primary forms of toxoplasmosis depend on when and how it was contracted, as follows. /r/n/r/n More than 40 million people in the United States have toxoplasmosis, but they don't all get sick. It's most dangerous to people with a weakened immune system, whether due to an acute infection, reactivation, or chronic toxoplasmosis. /r/n/r/n The most common symptoms of toxoplasmosis in healthy individuals include fever, swollen lymph nodes, and muscle aches and pains. However, many people with toxoplasmosis don't have any symptoms. /r/n/r/n People with weakened immune systems, such as those with HIV, have more severe symptoms. This can include brain and eye damage. /r/n/r/n People with toxoplasmosis may have the following. /r/n/r/n Even in healthy people, symptoms may last weeks or months. After symptoms improve, the person has dormant toxoplasma parasites in their body in cysts. Because these cysts hide the parasite in the body, toxoplasmosis never really goes away. /r/n/r/n If a previously healthy person with inactive toxoplasmosis infection develops a weakened immune system, the parasite can reactivate and cause disease. /r/n/r/n In pregnant people, active toxoplasmosis infection can cause pregnancy loss or congenital disease of the fetus. /r/n/r/n Symptoms of congenital toxoplasmosis may not appear until months or even years after birth. Newborns may appear healthy but have symptoms later in life. /r/n/r/n Congenital toxoplasmosis can result in a larger or smaller head than is typical. It can also cause symptoms such as the following. /r/n/r/n If you are pregnant and have a swollen lymph node, contact your healthcare provider. If you have any symptoms of toxoplasmosis and have a weakened immune system due to illness or cancer treatment, contact a healthcare provider. /r/n/r/n Toxoplasmosis is caused by the parasite Toxoplasma gondii. In the wild, Toxoplasma is transmitted between rodents and cats and birds. House cats can acquire it if they venture outside. Farm or game animals can acquire toxoplasma in their environment. /r/n/r/n Humans can acquire toxoplasmosis from exposure to the parasite's eggs in their environment. The parasite eggs can be in the soil of, for instance, a home garden. Make sure to clean all garden produce well before eating, and always wash your hands after working in the soil. /r/n/r/n Humans may acquire toxoplasmosis by any of several routes, including /r/n/r/n. If you have a cat that goes outside, you can acquire toxoplasmosis. While outside, the cat may come into contact with toxoplasma and acquire an infection. Once infected, the cat has eggs of the parasite in their feces. Cleaning the cat's litter box, especially if you have a weakened immune system, can lead to toxoplasmosis. /r/n/r/n Toxoplasmosis is not considered a sexually transmitted infection, STI. Toxoplasma can be transmitted through sexual contact, but that is atypical. However, it is more likely to cause long-term, chronic infections in people with the STI HIV who have weakened immune systems. /r/n/r/n You can reduce your risk of acquiring toxoplasmosis through food safety measures and avoiding environmental risks. /r/n/r/n Food safety measures include /r/n/r/n Environmental safety measures include /r/n/r/n Safety measures for people who live with cats include /r/n/r/n Our cat can only transmit toxoplasma when they are first infected, for the first 1 to 3 weeks. The cat usually has no symptoms. It's not recommended that a person at higher risk, pregnant or with a weak immune system, find a new home for their cat. /r/n/r/n If a healthcare provider suspects a toxoplasma infection, they typically order tests to look for antibodies to the parasite in the blood. /r/n/r/n To determine when someone acquired the infection, which can be important for pregnant people, the test can compare the levels of 2 types of antibodies: immunoglobulin M, IM, and immunoglobulin G, IG as follows. /r/n/r/n In some cases, a healthcare provider may also recommend imaging tests, such as magnetic resonance imaging, MRI, or computed tomography, CT, scan, to determine if toxoplasmosis has caused any damage to the brain or other organs. They may look into the eyes for lesions. /r/n/r/n The healthcare provider may want to examine specific tissues or bodily fluids under a microscope to see if they can see THE parasite or cysts directly. For this, they may want to perform a biopsy, removing a small sample of tissue for examination in a lab, or collect cerebrospinal fluid from the spine. /r/n/r/n To test if a fetus has been exposed to the parasite, tests can detect the parasite's genetic material in the amniotic fluid collected by amniocentesis. /r/n/r/n Treatment for toxoplasmosis depends on the person's immune health and if they are pregnant, as follows. /r/n/r/n A qualified healthcare provider will order testing and provide treatment as required. Doses and duration of medications may vary. Medications used to treat toxoplasmosis include sulfadiazine, daraprim, pyrimethamine, and folinic acid, leucovorin. In some cases, clindamycin or azithromycin may be used as well. /r/n/r/n Most healthy people have no symptoms of toxoplasmosis. People who do have symptoms often recover with no long-term effects. But because these cysts stay in the body, toxoplasmosis never goes away and can reactivate if a person's immune system weakens. /r/n/r/n Children born with congenital toxoplasmosis have symptoms their entire lives. Complications of toxoplasmosis may include /r/n/r/n People with weakened immune systems who acquire a toxoplasmosis infection need to be on medications for the rest of their lives to keep the parasites at bay. /r/n/r/n Coping with toxoplasmosis can be challenging, especially for individuals with weakened immune systems or pregnant people. Here are a few strategies that may help. /r/n/r/n Pregnant people with toxoplasmosis should consult with a healthcare provider and follow the recommended guidelines to protect the fetus's health. /r/n/r/n Toxoplasmosis is a disease caused by the parasite Toxoplasma gondii. This parasite infects the brain, eyes, and muscles. It forms bubbles in the tissue called cysts that house the parasite. These cysts may persist after the person is no longer sick. /r/n/r/n The three forms of toxoplasmosis are acute toxoplasmosis, congenital toxoplasmosis, and chronic toxoplasmosis. /r/n/r/n The most common way humans acquire toxoplasmosis is by eating undercooked meat with cysts. It can also be in their environment, such as on unwashed vegetables from the garden or in cat feces from a litter box. /r/n/r/n Treatment for toxoplasmosis isn't needed in most healthy people. Others may get a combination of medicines. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.